Good afternoon, everyone. I am Dr. Kishore Kumar. I'm the senior neonatologist and founder chairman of Cloud9 Group of Hospitals. I am also adjunct neonatology professor in Notre Dame University, Perth, Australia. I originally graduated as a pediatrician in Mysore University with a gold medal, and after that I wanted to specialize in neonatology, so I went abroad and worked abroad for about 15 years. And my main interest is saving a child, because when I graduated as a pediatrician, I used to see at least 10 to 15 deaths in any hospital per day. And my intention was to definitely save as many babies as possible. Today, I'm going to talk to you on vaccination in children, adults, and old age group. Vaccinations saves lives, but vaccines are not going to be useful unless we vaccinate people. Now, vaccination, when we talk about it, we always think it's only for children. Unfortunately, especially in India, people think that vaccine means it's a child's thing, but we can vaccine all ages, and vaccines saves life only when you use it to vaccinate people. When I was MD, if somebody had told me that in 20 to 30 years, polio will be eliminated, I would have years ago, and we used to see 2 to 3 deaths a day in one government hospital. What does it mean? We are talking about polio being eradicated from the world now, and clearly we have achieved that goal because of the vaccinations. Similarly, smallpox at one time, a dreaded disease, has been virtually eliminated because of vaccination. So vaccines are not just for babies, adults need them too. We have to focus on increasing the vaccinating adults, and especially pregnant women, because if a pregnant woman is not protected, not only she is, and she can also pass on unimmunized child to the community who can be susceptible to a lot of infections. The two key reasons to get vaccinated is to protect ourselves and to protect those around us. What most people don't realize is sometimes you may get infection, and even if you're lucky enough to survive those sort of deadly infection, you may spread that infection to somebody else around you, especially your loved ones. If you want to prevent that, then definitely vaccination has to be done for everybody. And it is important to get the vaccines you need on time, every time, including the booster doses, to give you proper protection. Vaccination should not be delayed. For most vaccines, it's never too late to catch up. If you are in doubt, you should talk to your pediatrician so that you will understand what it is about. When you vaccinate your child, you should ask your pediatrician about vaccinations for adults too and for grandparents too. It is very, very important that you vaccinate not only your child on time, but your family too. Sometimes what happens is we are all busy and we think that vaccines are only for children, and we protect them, and time keeps flying away and we don't know that we are getting older. As a pediatrician myself, when I crossed 50 years of age, I had forgotten almost for all practical purposes that I am eligible to get a vaccine for pneumococcal infection, which has been licensed for adults above 50 years of age. So I did take, but it was almost a year later. So anybody who is susceptible should be taking the vaccine, not just for the child. We also should know about the travel vaccines, which we have to do for each and every country, because travel vaccines also protect when you travel somewhere. And unless you do that, you may end up having a disease which can grievous hurt, disability, or even death, depending on what is the problem. For example, if you are planning to travel to South Africa or to South American continents, you have to vaccinate yourself with both polio and yellow fever vaccines. Otherwise, if you get yellow fever, it can be detrimental. So travel vaccines protect you when you travel. Other vaccines protect you when you're healthy. And all healthy people need vaccines to protect them from the deadly diseases. We call it as a vaccine preventable diseases, and vaccine preventable diseases are better protected by vaccines rather than suffering from the diseases which are not going to be present. Not long ago, when we were postgraduates, we used to learn count your children after measles. That was used to be the proverb. That means when my parents were born, for all practical purposes, they used to say, if the child survives the first year, they will survive forever. The reason is in the first year, the measles disease used to come in, and they used to think that a lot of these measles diseases are caused by the curse of the god, and if the god is blessed the child, then they'll survive. That was a myth. And those days, if a child survives the first year, then they have allowed the child to go ahead and lead normal life. Today, we know that measles is not due to a curse of God, it is due to a virus, and vaccine against measles is very important to protect your children. I think I've spoken enough, and I'll see what are all questions which are coming up because I think people have got a lot of questions, and I shall start answering them one by one to take you through the questions. The first question here is from Pooja Rashmi Singh, and it is sorry. Hi, doctor. 6.5 months old. One vaccination is pending. Now she is 8 months. Can you advise? Well, Rashmi, this is a common question. A lot of people get worried. And the answer to your question is the primary vaccination should be given as soon as possible. But what you are is your child is 6.5 months, which means that your primary vaccination at 6 weeks, 10 weeks, 14 weeks has already been done. And 6 months, the first dose of flu vaccine we usually give, and you are due for the second dose of flu vaccine according to what you are written. And if it is delayed by a little bit longer, it's not a major concern because you are due for the second dose of the flu vaccine. So if it's a booster dose, even if it is delayed by a little longer, it's not a problem. But the primary vaccination preferably should be on time. Pandemic of coronavirus is not to vaccinate children. The next question is Priyanka Karambelkar. Hello, sir. My son Karthik is 3 years, 11 months old, and his typhoid vaccination is delayed because of extended lockdown. Is it safe? Priyanka, that's an interesting question. In the past, we used to recommend typhoid vaccine every 3 years. Now, there is a conjugate polysaccharide vaccine, which means that in the past we used to give only polysaccharide vaccine. Now there's a conjugate vaccine that has been available for almost close to 3 to 4 years. If your child has had conjugate vaccine, the child is protected until 15 years. The booster dose can be given anytime later. There's no urgency. Secondly, typhoid is a disease transmitted by contaminated water and contaminated food. Now that you're in lockdown, you are cooking at home, you are looking after the food and water. So the risk of typhoid is much, much lesser unless you eat outside and various other foods outside. So you don't have to worry. Even if it's delayed by another 1 or 2 months, typhoid vaccine is not a major concern. Next is Vivek Jha. My son vaccinated with all 6, 10 weeks vaccine, but 14 weeks vaccine are pending. What to do? Vivek, this is a very, very good question because 6 to 14 weeks, we always say it is the primary vaccination. But what you're saying, already done the 6 and 10 weeks vaccination, and 14 weeks vaccination is pending. The gap between 10 and 14 weeks vaccination can be as long as 2 or 3 months if required. But generally, we don't prefer to say that you can delay it. But a few weeks delay doesn't matter. Now that lockdown is going to be over on May 3rd, you can do the vaccinations after that. So it's not a major concern. Sorry, and sir, मेरे बेबी का इंजेक्शन 2.5 और 3.5 का कभी बाकी है, लॉकडाउन के करने के अगर लगे तो प्रॉब्लम नहीं होगी सर, प्लीज आंसर मी सर. सोनी, दिस इज अ गुड क्वेश्चन. आपको ड्यू डेट 2nd में और 3rd में है, इसमें लॉकडाउन में हो जाएगी, उसके बाद दे सकते हैं. कोई घबराने का बात कुछ नहीं है उधर. अगले क्वेश्चन है इधर, रचना डुबे. Hi sir, unable to give 45 days vaccination due to lockdown. How much we can delay? Rachana, this is 45 days is 6 weeks vaccination, and normally we say 6 weeks vaccination should be done anywhere between 6 and 8 weeks. And because it's a primary vaccination, it's always better to be done earlier than later. So anywhere between 6 and 8 weeks. In other words, you have got 2 more weeks to go, and most people have started vaccinating hospitals and clinics. So you should talk to your pediatrician, and you should be able to get the vaccination done in the next 2 weeks. Next is Sudipta Sonai. Hello sir, मेरी 4 years baby girl है, उसको बहुत सर्दी बुखार हो जाती है, कॉफ वर्सेस रहता है, कौन सा वैक्सीन देना सही होगा? सुदीप्ता, वो बहुत इम्पोर्टेंट क्वेश्चन पूछे आपने. वैक्सीन देने तक हम बच्चों को अच्छे तबीयत में देखना पड़ते हैं. बुखार रहे तो हम वैक्सीन नहीं देते, खांसी रहे तो वैक्सीन दे सकते हैं. अगर बुखार रहे तो हम बुखार के बाद ही वैक्सीन करते हैं. बुखार होने तक हम वैक्सीन जनरली नहीं करते. आप आपका पीडियाट्रिशियन को बात कीजिए. नेक्स्ट इज माधवी कॉलरा. हेलो डॉक्टर, अभी लॉकडाउन की वजह से मेरे बेटे को टाइफाइड की वैक्सीन दिला पाई हूँ. डॉक्टर ने जो डेट दी थी उससे आगे 2 months हो चुके हैं, इससे प्रॉब्लम कोई नहीं रहते. माधवी, मैंने अभी आंसर किया. टाइफाइड वैक्सीन एक नए तरह की वैक्सीन आया है, वो बोलते कॉन्जुगेट टाइफाइड वैक्सीन और टीसीवी, टाइफाइड कॉन्जुगेट वैक्सीन. ये एक डोज दिया तो बच्चों को प्रोटेक्शन रहते हैं. दूसरे डोज रहने वो बूस्टर डोज कहते हैं. बूस्टर डोज दिया तो 15 साल तक इम्यूनिटी रहते हैं. सो थोड़ा डिले टाइफाइड का वैक्सीन होया तो कुछ तकलीफ नहीं, क्योंकि वो वाटर डिसीज है. Sonam Patel, can the vaccine be delayed? Lockdown has made it difficult for people to go outside. So is it fine to delay by a month or so? Sonam, I think I just answered your question previously. And the answer is, if you have a baby, we suggest that primary vaccination has to be done as soon as possible. Primary vaccination is that 6 weeks, 10 weeks, 14 weeks, and the first dose of influenza and measles vaccine at 9 months. Any other vaccine, if it is delayed by a few weeks, it doesn't matter because they're more or less booster doses. Next question is here. Shilpi, 2 types of DPT, pain and painless. Any differences in result? Shilpi, a बहुत important question है, and the difference is really in the price of the vaccine. The pain and painless is vaccine is what it means is the DPT is one of the vaccines which protects you against diphtheria, whooping cough, or called pertussis, and tetanus. It is basically, in the olden days, used to be called triple antigen. Nowadays, it is always combined with hepatitis B, polio vaccine, along with the Haemophilus influenza type B. Obviously, there are two types, pain and painless. What it means is, it's not that pain vaccine is very painful. The pain vaccine, so-called pain vaccine, is a whole cell vaccine. That means the pertussis component of the vaccine is whole bacteria is there. Whereas in the painless vaccine, it is the purified version of the pertussis vaccine, or we call it as an acellular pertussis. What it means is, whatever actions that is required to make the vaccine is taken out, and the protection is almost equal to the vaccine which is normal. It is a purified vaccine. The side effects from the DPT, like the lump at the site of injection, pain, fever, is significantly reduced. So the difference in the vaccination, both pain and painless, are almost the same. But there is a myth in lot of parents that child has to have a pain to get the immunity. If you believe in that myth, you can give the normal vaccine. Otherwise, you can give the painless vaccine. The only difference is painless vaccine is slightly, not very expensive, slightly a little bit more expensive. But the best person to advise you for this is your pediatrician, and you should talk to your pediatrician regarding this choice. Next question is Aarti Joshi. Vaps कब तक लगेगा ठीक से बताइए. वैक्सीन कब तक बताइए. Well, this is an important question, Aarti. वैक्सीन कब तक दे सकते हैं? वैक्सीन सभी एज को दे सकते हैं. हम सिर्फ बच्चों का बात कर रहे हैं इधर, मगर प्रेग्नेंट लेडी को वैक्सीन दे सकते हैं, एडोलेसेंट को वैक्सीन दे सकते हैं, ग्रैंड पेरेंट्स को वैक्सीन दे सकते हैं, ग्रैंड पेरेंट्स को न्यूमोकॉकल वैक्सीन दे सकते हैं, फ्लू वैक्सीन दे सकते हैं, हेपेटाइटिस बी वैक्सीन दे सकते हैं. सो सभी एज को वैक्सीन दे सकते हैं. ठीक पर्सन सबको ये सभी आपको बात कर सकते हैं इज योर पीडियाट्रिशियन. Lakshmi Mishra asked the next question. Doctor, I'm giving my child the regular boosters or other injections which has to be given as per the child's age. So is it necessary whenever the government runs the polio drop campaign, I should give her the government polio drops? Lakshmi, this is a very, very common question. Most of my patients keep asking this question, and the answer is yes. Now, the difference is you give the vaccine to your child and you protect the child. But all of you know, has been eliminated from the world immunization. Now, what is pulse immunization? Whenever there is a possibility that polio disease is going to be spreading in the government gets pulse vaccination done to the whole population in India. In other words, it is given on the same day to every child so that the vaccine protects the children and the polio doesn't get a chance to affect anybody because herd immunity. In other words, to make talk about coronavirus. Now coronavirus is spreading. Why? Because talk about coronavirus. Now coronavirus is spreading. Why? Because everybody is susceptible. Say, for example, if you had a vaccine and if you had vaccinated everybody in India one day, coronavirus doesn't spread. Unfortunately, there's no vaccine for coronavirus. Otherwise, you could have done it. Polio drops, pulse polio, that is exactly what is called. Pulse polio means you vaccinate everybody under the age of 5 years in one day. It's a massive task. It's a very, very responsible job. That's why WHO, UNICEF, Government of India, various organizations, Rotary Club, Bill and Melinda Gates, and it's done. So pulse polio you should never miss, especially if your child is under the age of 5 years. So pulse polio is different from the polio drops which you get from your pediatrician. Now the next question is Lisa Gogoi. Sir, my child is 5 years old and we missed the booster dose due to lockdown. What should we do? Lisa, that's an important question. Booster dose is very, very important, but booster dose, as the name indicates, boosting the immunity which has already been given to your child. Because your child is 5 years old, even if it is delayed by another 1 or 2 months, doesn't matter. But it's important to boost the immunity after the lockdown is over. Not to worry, talk to your pediatrician. Rachana Dubey is asking the second question. My baby's primary vaccination at 6 weeks is already delayed by 1 month due to lockdown, and doctors at my place are still not giving vaccination. How much more long can we wait, and what shall we do? Rachana, this is very important. I don't know where you live, but this vaccination is a primary vaccination, and vaccination is equally important. WHO, Indian Academy of Pediatrics, Government of India have all said that vaccination should be carried out during pandemic. And if your child is already delayed by 4 weeks, then you should be able to get it done by talking to your pediatrician or by nearby government clinics, because government has said they will start vaccination from this week. So 4 weeks is a good time, and you should be able to start getting vaccination. Please talk to your pediatrician, because most pediatricians have started vaccinating their kids now. And next question, somebody has not put their name, but it's a question, sir. Due to lockdown, my 45 dose baby vaccination is pending. She's 2.5 months old. My doctor told me that I need to wait because of lockdown, and it's risky for babies to take them in hospital. Please advise how long can be delayed. I think I just answered that question just now for Rachna. Abhishek Lalla, hello doc. How important is chickenpox vaccine? I could understand from my colleague that chickenpox is not that common and it's not mandatory by the government. What is your take on this? Should I give my kid chickenpox vaccine? This is a very, very important question, Abhishek, and thank you for asking. Chickenpox vaccine is one of the surprising vaccines in the United States of America, and a lot of people thought that. Now, if you look at the 50 children died fatal death or a stillbirth due to chickenpox, we don't know. Chickenpox normally is a mild disease, but it can cause what we call as a silent pneumonia and can kill people. Not only that, if you get a chickenpox during old age, you will get what we call as herpes zoster, and that is extremely painful, and it can cause a lot of problems for old age people. And if you get chickenpox as a child, old age people will be susceptible to get herpes zoster. To avoid all these problems, it is better to give chickenpox vaccine. Chickenpox vaccine, as I said, has been there, was England or UK, who used to have chickenpox parties to get children to get infected with chickenpox so that they become naturally immune for the rest of the world. Those sort of skeptics have started giving chickenpox. So my recommendation is done for your child. Next is Ujwal. Sir, my baby is 13-month-old and meningococcal conjugate vaccine second dose due from 12/4/20. How many days can I delay? Already given dose at 9 months. So any problem if second dose is delayed? Ujwal, this is a good question. Meningococcal vaccine is conjugate vaccine. Normally we give first dose at 9 months, second dose after 2 years. So you have plenty of time. Second dose can be given anytime after 2 years, so you don't have to worry. Sindhuja, doc, I'm pregnant mother with hepatitis B. I'm worried about my mode of delivery, normal or C-section, although there is no evidence. Sindhuja, this is a good question. If you are hepatitis B positive, now we call it as a vertical transmission. That means the chance of the baby getting infected at birth, and there is no difference whether you deliver normally or C-section. Most important is as soon as you deliver, your baby has to be given hepatitis B immunoglobulin and hepatitis B vaccine together at birth. That is the most important, which will protect you, not C-section or normal delivery. So you can either go whichever is easier for you. You talk to your obstetrician and pediatrician, but mode of delivery is not going to make a difference. Hepatitis B immunoglobulin and hepatitis B vaccine make difference. Amit Kapoor, hello. Dr. DPT booster is recommended 5 years. My child missed the date, now 6 years. Which vaccine is recommended? Amit, that's a good question. वो बूस्टर डोज है 6 बरस तक दे सकते हैं because it's a booster dose. You can give it even now. The immunity will be dormant, but once you give the booster dose, it's going to go up. So even though it's delayed by 1 year, it is still advisable to give it immediately so that your child is protected against those tetanus and whooping cough. It's never too late. Talk to your pediatrician and make sure that your child is vaccinated. I think we have answered most of the questions. I can't believe it. We have gone so quickly. Oh, there's one more question I missed here. Shilpi, my kid is 9-year-old, have asthma. Which vaccine are important? Shilpi, this is a good question. For children with asthma, the most important vaccine is flu vaccine, or what we call as influenza vaccine, which you should give every year. And make sure that you have protected your child with the pneumococcal vaccine, because children with asthma can get pneumonia, and there is a vaccine for pneumonia which you should give along with the influenza vaccine every year. Let me see if I have missed any other question here unintentionally. Arpita Jain here. Arpita Jain, hello sir, I have 2-month, 2-week-old baby, but उसका 1.5 का वैक्सीनेशन नहीं हो पाया लॉकडाउन के कारण. उसके तब तक दे सकते हैं, उसके डिले करने क्या कॉम्प्लिकेशन है? अर्पिता, ये बहुत अच्छी क्वेश्चन है. एज मैंने बोला 6 weeks and 10 weeks वैक्सीनेशन होती है ना, वो करते हैं हम प्राइमरी वैक्सीनेशन कह के. प्राइमरी वैक्सीनेशन इज वेरी वेरी इंपॉर्टेंट. डिले हुआ तो बच्चों को वो वैक्सीन प्रिवेंटेबल डिसीज हो सकता है, इसलिए 2 week 3 week डिले परवाह नहीं, क्योंकि आपका इम्यूनिटी प्रेगनेंसी से बच्चों को आती है ना, वो चले जाएगी 2 महीने के बाद. तो इसलिए आप पीडियाट्रिशियन के साथ बात करिए कि और वैक्सीन दिलाना पड़ेगा. थैंक यू. एंड Sonam Patel has asked another question. Hello, how long can the vaccine be delayed? Lockdown has made it difficult for people to go outside. So is it fine to delay by a month or so? I think, Sonam, I have repeatedly answered this question. Primary vaccination should be given as soon as possible. And even if it's delayed by 2-3 weeks, doesn't matter. But a booster dose vaccination, even if it's delayed by 2-3 months, it doesn't matter. But primary vaccination preferably should be given within 2 or 3 weeks of due date. What is primary vaccination? The 6 weeks, 10 weeks dose, and the first dose of flu vaccine and the measles vaccine are the primary vaccination. 14 weeks vaccination is almost like a booster dose. Second dose of flu vaccine is almost like a booster dose. Delayed, not a problem. I hope you understand. Thank you. And now there is a new question. Sindhuja has asked, thank you, sir, for clarifying on hepatitis B. I also have Graves' disease. What is the first thing need to get baby checked as soon as it's born? So I'm using methimazole. Sindhuja, that's a very good question. If you have Graves' disease, your baby normally should be tested for hypothyroidism at birth. But if you have been on methimazole, it's all the more reason you should be tested, our baby should be tested for underactive thyroid, what we call as hypothyroidism. Lakshmi Mishra has asked another question. Dr. Cervical cancer vaccination till what age can be given? Cervical cancer vaccination is recommended and licensed in India from any age of 10 years to 45 years of age. And it's a very good vaccine. Australia, according to the BBC News and the government news, is almost on par to declare whole country free of cervical cancer by 2021 because they started vaccinating every child from 2010 onwards. So it is a very good vaccine. In India, 1% dies of cervical cancer almost every 30 minutes. So it is a very good vaccine to protect, and you can give the children vaccine from 10 years of age onwards and adults up to 45 years of age. Suhas Yadav has asked a question here. Hello, date of birth is 25th January 2020. A 10-week vaccination due on 17th of April. I want to ask that how much time shall I postpone the vaccine or shall we give the vaccine on time? Our last vaccine was done on 13th March 2020. Suhas, I think I've answered this question, but I'll clarify again. 6 weeks and 10 weeks vaccine is what we consider as a primary vaccine. Now that you are given 6 weeks vaccination, 10 weeks vaccination can be delayed for another 2 or 3 weeks. Anyway, the lockdown is going to end in another 10 days. And soon after that, you should be able to give the vaccine and you should talk to your pediatrician. Next is Neha. I recently joined your session. My child is 9 months old. Our vaccination is due in this month, but due to lockdown, our vaccine is pending. How long can I give her or wait? Neha, 9 months is when we give the measles vaccine. As I mentioned, measles vaccine is what we consider as a primary vaccination. Generally, measles antibodies from mothers go to the babies and protect them for the first 9 months to 1 year. So generally, even if it is delayed by 1 or 2 months, it's okay because she would have had antibodies from your body, depending on how much of antibodies she would have got. If nobody in the neighborhood has got measles or it's not a measles season, then it's delayed, it's okay. But if you hear that measles are around in your house area, then you should get the vaccine as soon as possible. So to answer your question, please get your child vaccinated by talking to your pediatrician as soon as the lockdown is over. Now, what are the recommended vaccine for teenagers? Nanaware is asking. Now, this is a very good question. The teenagers need to be protected against tetanus, whooping cough, pneumococcal vaccine, pneumococcal disease, and also meningococcal disease. In addition, girls should be given cervical cancer vaccine and flu vaccine every year to prevent them from getting influenza, which can get transmitted from them to their grandparents if they're living together. So in other words, you can vaccinate the teenagers for about 5-6 diseases, and the best person to talk to is your pediatrician. And if they have not been vaccinated against hepatitis B and hepatitis A, when they're children, they should be vaccinated even at the teenage. Shilpi, we have not received so many vaccines. Why our kids are getting so many vaccines? This is a very, very important question, Shilpi. I really admire you for asking this question. Now, that's a question, if I give you some context, when my dad was born, my grandparents had 14 children. 9 survived, 5 died, and that was accepted as a norm. Those days, children used to die from various diseases, and from what I hear, 2 children died of polio, 2 children died of measles, and 1 child died of whooping cough, and 5 children had died, and my parents, 9 siblings survived. Now, if you think you're going to, don't have to vaccinate. But nowadays, most people are having 1 or 2 children, and they don't want to lose them. Vaccine preventable, a healthy child becomes definitely or disabled in various ways. So just to give you an example, I had explained in the initial stages, in MD, when every day in one hospital, 3 cases of pyogenic meningitis. That means pus all over the brain, making children deaf, blind. They would have become mentally deaf. Now, because of vaccination, we have vaccination definitely prevents such. My child is precious, and see whether the bacteria listens to you. I hope I understood. Sindhuja has asked one more question. Does injections plays a role in the efficiency of the vaccine? Please mention where you by mouth. So definitely the place where a lot of people used to get it under the toe or under the bum, and the protection depends on. Uncommon for parents to ask that question. My answer to that question is 70% of the milk a day, you don't need to give extra water. But you have been outside, rule of thumb, they don't need to be given water. Neha, and now on other parts of the body, she's also having fever for last 2 days. She's also having teething problems. She's 9-month-old only. Neha, I think we are talking about vaccination. From what you have written, it looks like your child has got some sort of a viral infection, fever, rash on the face, and also having teething problems. Then it's better to see your pediatrician and consult. Shraddha has asked the next question. Hello, doctor. We have been told about 2 types of pneumococcal vaccine to be taken for my baby. Which one should be taken? This is a very, very important question, Shraddha. And I think the right person to decide is discuss with your pediatrician and talk to them. Briefly, I can say the 2 pneumococcal vaccines which are available are, one is 10 serotypes, the other one is 13 serotypes. That means the one vaccine has got 10 serotypes among the 64 serotypes which can cause infection, and the other vaccine contains 13 serotypes. Now, in India, if you look at the number of serotypes which can cause pneumococcal pneumonia or infections or pneumococcal disease, roughly it equates to 70% of the bacteria covered by the 10 serotypes and about 85% with the 13 serotypes. Then comes the cost. 13 serotypes cost about 3,800 rupees. 10 serotypes cost about 1,500 rupees. And so the cost matters, coverage matters, and the best person to talk to is your pediatrician. Hello, sir. This is Subulkandan. Subukalandar. 3.5 months non-IPA, 5 months complete IPA. Are seen in BCG injection site. Does it indicate a failed BCG vaccination? Is in need for a second vaccination? Our date of birth is 3rd February 2020. Amit, this is a very, very important question. Normally, I say that BCG vaccine takes nearly 4 months to show the scar, because this is the only vaccine which is given between the layers of the skin. So the healing process takes very, very slow. First 2-3 weeks, you don't see anything at all. After that, you may see small pimple-like lesion. Then you may see sort of a pus-filled lesion. Then that pus-filled lesion will rupture, and then it will lead to scar formation. Having said that, 5 to 10% of children may not get any side effects of the BCG, and no scar is also produced. So it is possible that your child is one of those 5 to 10% of people who may not be getting any side effects in scar. But the best way to know about all this is to talk to your pediatrician, see and discuss, especially in the hospital where she was born. But certainly there is no need for the second BCG vaccination as a routine. Nayana has asked the next question. Are there any vaccines which are optional? This is a good question, Naina. Optional, yes. There are quite a few vaccines which are optional. For example, hepatitis A vaccine is optional. Meningococcal vaccine is optional. Currently, cervical cancer vaccine is optional. But all other vaccines, more or less, is mandatory for children, especially under the age of 1 year, because otherwise, the chances of the child getting vaccine preventable disease, which can kill them or cripple them, is very, very high. Arpit Jain. Hello, doctor. My question is my daughter is 4 months old. Her 10th week vaccination is already delayed due to lockdown by 1 month. Please suggest. Arpit, I have answered this question in the past, but for your benefit, I'm going to tell you again. 6 weeks and 10 weeks vaccination in a baby is considered as a primary vaccination. They should be given ideally as soon as possible. Maximum you can postpone is by 1 month. If you've already delayed the 10th week vaccination to 4 months, I would suggest you talk to your pediatrician and get the vaccination done as soon as possible. Booster doses can be delayed much longer, but not the primary vaccination. And both Government of India and all the doctors have started vaccinating children now. So you should talk to your pediatrician and get your baby vaccinated. Now, Naya, sir, this has been a very helpful live talk. Thank you. BabyChakra is always helpful due to the superb doctors on it. And it has been wonderful to have a senior doctor like you on this wonderful platform too. Thank you for your time and your patient advice. Thank you, Naya. Really, really appreciate, especially because this is a one-way talk. Having such feedback will really be helpful for us also. Now, there is Vija who is asking this question. She's a psychologist. My baby's birth date is 13, 14, 19. Her 14th week vaccination was due on 7/4/19. Couldn't give due to lockdown. How much can we wait? Sanhita, I think you meant 7/4/20 probably because you returned 7/4/2019. Now 14-week vaccination is considered as a semi-booster dose because you've already given 6 and 10 weeks vaccination. So even if it's delayed by 2 to 4 weeks, it's okay. As I mentioned earlier, now everybody has started vaccinating. So you can talk to your pediatrician and get the vaccination done. Now, next question is, we have finished all the questions. So, Naina, we are answered most of the questions. And there you go. One more question. Vivek Pandey, my son is 15 months old. I have not given any 15-month or 18-month vaccination, varicella, due to the lockdown. How much I can delay? Now, this is a good question, Vivek. If you have not given the 15-month vaccination, you can delay by at least another month or two. Doesn't matter because you have given the 9th month measles vaccination, which is very, very important. At 15 months, you give MMR, which is more or less like a booster dose for measles. But chickenpox and the PCV is a booster dose because you have given it 6, 10, and 14 weeks. Varicella vaccine is the first dose of vaccine of chickenpox you are going to give because currently there are not much of children with chickenpox. If it is delayed, it's not a problem. But if there is a lot of chickenpox in the area you live, then I think you should go and get the vaccine done as soon as possible. Now, Vinod has asked the next question. Doctor, pentavalent vaccine or a 6-in-1 vaccine, what is the difference? Are we taking oral polio injection? This is a fantastic question, Vinod. I need to congratulate you for asking this question. Now, I was mentioning earlier, maybe you joined late, polio is one of the diseases which has been eliminated from the world. Currently, polio is eliminated from the whole world except two countries, Pakistan and Afghanistan, and pockets of Syria and Nigeria where the war has been happening. Otherwise, virtually, polio is free from the rest of the world. Now, why is it important for you to understand this? Polio vaccination has made this elimination of deadly disease called polio, which is a success story of vaccination. Now, polio is given by oral drops, and it's a live virus vaccine. Once a country or the world becomes free of polio, giving polio drops, which is a live virus vaccine, live virus, because it's not there, the disease, has a theoretical possibility. Please remember this, a theoretical possibility that it can cause polio in a healthy individual, because now the herd immunity due to wild virus are disappearing, starts becoming less. To avoid that theoretical possibility, we are reducing the number of drops being given to the child, and polio injection is being given because polio is eliminated. But if the polio were to be endemic, then you do need the drops, because you need the gut immunity, because that's how the polio spreads. I hope I've answered your question. So it is important to give the polio injection, because polio injection contains type 1, type 2, type 3 vaccines. Because the world has eliminated of polio disease, and because of the possibility of vaccine derived poliomyelitis, the vaccine which we give now does not contain the type 2 virus, so the child will not be completely immune with the polio drops if we give it in India. I hope you understand that. My son's typhoid vaccination is delayed because of extended lockdown. Is it safe? Priyanka, I think that's a good question, but maybe you joined later. I answered that question already. Typhoid in the past we used to give once in 3 years, called a polysaccharide vaccine, whereas now we give what we call as a typhoid conjugate vaccine, and one vaccine protects the child for almost 3 to 5 years. A second booster dose protects them until 15 years of age. So I'm not sure how old is your child and which one you're talking about. But having said that, typhoid is a disease which spreads by contaminated water and food. Because you are in lockdown, you are taking care of your child's water and food needs. The risk of typhoid at home is much, much less. So even if it's delayed by a few weeks and months, it's not a problem. Akriti Jain has asked the next question. Hello, doctor. I am confused regarding the vaccination brands. Can the repeated vaccines of rotavirus and PCV be different brands or should be the same month? Well, this is a very, very important question. And thanks for asking, Akriti. And the answer to that is the WHO has clearly mentioned that DPT vaccine and pneumococcal vaccine brands changing is not a problem. And rotavirus, people were not sure until recently, but now it's very clear that as long as you give the required number of doses, the brand doesn't matter. But ideally, once you give one brand, you should stick to this. Further doubts, I would suggest you discuss this with your pediatrician, because sometimes availability and various other issues also matter. Mona Lisa Anand. Sir, my daughter is 4.5 years old. Is there any dose which help in building our immunity? Monisha, the best immunity is balanced diet. Balanced diet means good protein, good nutrition, good things. Along with vaccinations, you do the vaccinations. At 4.5 years, the child needs protection against diphtheria, tetanus, and whooping cough, along with booster dose of MMR and chickenpox. I'm sure your pediatrician is the right person to take it further. Now, somebody has asked, give few more tips to close the session before you close. So I'm going to talk some tips, unless there are some more questions. Ajit Yadav has asked the last question here. In 8th month of pregnancy, which all vaccine is important? Now, this is very, very important question. 8 months of pregnancy is almost like you're on the battlefield. And which all vaccines are important? I think for a pregnant lady, whooping cough and tetanus vaccines are very, very important. If it's not been given, you should give it. And influenza vaccine, if it's not been given, consider giving it. But best person to talk to is your obstetrician. Now, Sindhuja, there are some unusual articles where vaccination in newborns are connected to issues like autism, and also vaccinations reduces natural immunity. What's your opinion on this? Sindhuja, fantastic. I'm glad you asked this question because in 1989, there was a pediatrician in Bristol, Southern, where he wrote an article in BMJ called Andrew Wakefield saying that hypothetically there is a theoretical possibility that MMR vaccine can cause autism. Now, subsequently, there was a wide amount of research because suddenly people started stopping vaccination, and measles and rubella became very, very common disease all over wherever they stopped the vaccination. And they found that this guy was a troublemaker and had written this article, and the journal withdrew that article and he was deregistered to practice as a pediatrician. Not only that, Denmark did a study involving more than 5 lakh babies and to see if there is an association subsequently, and they have proven beyond doubt that there is no association with MMR and autism, and it is just speculation. Now, the other reason why all these things have come in is when we were postgraduates, we used to read autism being diagnosed at the age of 4 years because we didn't understand the disease that well. Now we diagnose children under the age of 1 year autism. So this guy in 89 wrote a speculation, but autism link and MMR is so baseless. For example, MMR is given at 15 months, but we diagnose children with autism at 8-9 months nowadays because the knowledge and understanding of the disease is much more better. So where is the link? We are diagnosing autism even before the MMR vaccine is due. So there is absolutely no truth in the link of MMR vaccine causing the autism. Now, 2 more questions have come, and hello doctor, we have been told 2 doses and 3 doses of rotavirus vaccine. How many doses are good? Shraddha, this is a very important question. 2 doses are required if you give a rotavirus called, which was monovalent vaccine called Rotarix, or if it is 3 doses, if it is a pentavalent vaccines. I think the best person to answer this question is your pediatrician. You need to talk to which brand you want to choose. Now, I think we have finished that things, and our last question popped up. Priyanka, my son is 3 years, 11 months old, and he is scheduled to Chickenpox vaccine 2 and typhoid vaccine in April. But basically, I'm from Gujarat, stuck up in Indore. What should be done? Priyanka, not to worry. This is a booster dose, so even if it's delayed by a few months, it's not a problem because both are booster doses. Absolutely not an issue, and not to worry. I think we are going to end the session because we have run over time now. And just before closing, I wanted to give you a few tips. Vaccines are fantastic, but they're useless unless we do vaccination. So vaccines don't protect, but vaccination protects your children. And remember, I am too young, but I'm not old either. And as a postgraduate, I used to see polio. And if anybody had told as a postgraduate that polio will be eliminated in the world in the next 10 years, I would have laughed at them. And that used to be the stage. Now, I have seen in my life polio being eliminated. A lot of older people have seen smallpox being eliminated. And younger generation have seen pyogenic meningitis due to Haemophilus influenza type B vaccination, eliminating the pyogenic meningitis. Pneumonia virtually is being eliminated due to pneumococcal disease. So all these are killer diseases. Killer diseases means if a child gets these diseases, there's no way the child can survive. We are very, very fortunate in being in this century and have the option to protect our children rather than counting children after such diseases. So it is your responsibility as a parent, grandparent, the guardian of the children to vaccinate children. At the same time, don't forget, vaccination is not only for children, it is for adolescents, adults, grandparents, because many vaccines have come recently and the older population may not have been vaccinated. The best example is anybody who is older than 40 might not have been vaccinated against hepatitis B because hepatitis B vaccine became available only 30 years ago. So make sure that everybody at every age gets vaccination done for the relevant diseases. And the best person to talk to is your doctor. And thank you all for being patient hearing. And I thank BabyChakra for giving me this opportunity. And I thank GSK for making this possible to disseminate the knowledge. Thank you very much.